Hi guys, welcome to another session with Myrtle for pre-surgery preparations. I am getting ready for that knee replacement in about 10 days now. So we are actively pursuing some of the things called compression today in our installment. And what compression really means is hoping to reduce inflammation, reduce swelling that can happen as a part of those surgical procedures. So a lot of this you will see after my surgery, and there are other ways to do it manually with different bandages or even with machines that you might see after surgery. But now pre-surgery, it's important for me, and it might be an important task for you to go ahead and get them wrapped every day prior to surgery. Some people have conditions known as lymphedema, where there is a natural swelling within the body, and compression really helps control that and does a reduction. Other people have lipedema, which is myself. It's an LIP versus an LHM. And lipedema is really a collection of different fat cells within the legs or the arms or certain areas of your body. Now, compression may not naturally reduce or shrink that to the extent that you would see in the other situation, but it's always a good idea to really take that regimen onto itself in that situation like I am prior to surgery so that you can be as ready as possible. Give yourself the best fighting chance from any swelling or inflammation that could happen. The better prepared you are and the more proactive you are prior to the surgery, the better outcome we hope to obtain after when we're doing the same regimen of treatment. Now, most of the times you're going to go to a physical therapist, your orthopedist, an occupational therapist. They're going to give you the right techniques, the tools, the dressings to go ahead and do that work. And they're going to teach you how to do it so you can do it at home like I am today. So one of the other important things about compression that we're going to talk about before I show it to you a little bit is the cleanliness of it. So if you're getting wraps, not necessarily electronic devices, but that could place too. Cleanliness of those things are really important because you don't want to set yourself up for any infections or kind of just dirtiness in general. The closer you get to surgery, the more after, the more important that is to avoid those germs, bacteria. So when you're doing compression, like I'm going to show you in a minute, it's going to be very important that you wash those dressings every day, especially in my situation because I'm having to wear them 8 to 10 hours a day. So when now that's happening and you're either sitting or walking, that does accumulate. And so again, you want to be as clean as possible. So I'm going to show you and move the camera down a little bit about what those dressings look like on one leg that I haven't unwrapped and another that I'm in the process of unwrapping so that you can kind of see how that looks with those ACE bandages that I'm wearing. So let's kind of go ahead and take a look. So if you look right here at the dressings themselves, and I'm going to turn the camera a little bit more toward this, you can see that there's just some little nice slough material that really protects your leg from the dressing down here, which is the ACE bandage portion. And when you take that off, you just want to really rewrap it. Again, when you go to wash it every day, put it in a nice contained bag so you're not putting it just loose in the dryer because rolling it's a chore. And now I'm going to take you over to the other leg that's still kind of all put together so you can see how it all looks when it's wrapped. So when you see the leg when it's wrapped, we actually have a protective layer on it that you'll see right here. This, as well as the ACE bandages that are right here, and the little sterile gauze dressing, all three of those kind of come together layer upon layer with some non-surgical tape. And those are the ones that you can actually put in the wash. This protective layer, these ACE bandages, again, and then this sterile gauze. All of those actually go into kind of coming off of the leg on a daily basis and then going into the wash. Again, wear these and put them on at the instruction of your physical therapist, occupational, orthopedist. The timing is important, what's right for you prior to surgery. So as we get into these T-minus 10 days, I'm going to show you some more practical things like this as we really start to get ready. And then we'll follow that journey after the surgery and we'll see how we do. So any questions, comments, go into my YouTube, give me a little holler, shout out. Let me know if you have a question. I can always find the answer or lead you to a right medical resource who's really going to impart you the right information. So again, I enjoy having you on my journey and we'll talk again later. Bye.